This is a patient in their 20s who comes in with abdominal pain, and we get a CT scan with intravenous contrast to further evaluate this. And I want you to focus on the right kidney in this instance. So we can see along the interpolar to lower pole region there is a very heterogeneous mass. Now it certainly looks like it's centered in the renal parenchyma, but it's very infiltrative in appearance. Its borders, at least portions of its borders, are quite ill-defined, but it does look overall rounded, and the overall shape does conform to the parenchyma of the kidney sort of expanding in that region. So a young patient with this very heterogeneous mass that is somewhat infiltrative, somewhat expansile in terms of the space in which it's occupying within the renal parenchyma. But if we look closer, we also see other disease over here. Right around here, we're seeing a big retroperitoneal node that's almost as big, if not larger, than the kidney itself. We see other retroperitoneal adenopathy, this here being a retrocaval node. And other sites of disease include extensive bony disease. Look at this metastasis along the posterior aspect of the vertebral body involving the rib. I'll put it on bone windows to better see that. If we go down, we can see additional metastases involving the lower lumbar spine. We see other metastases involving the iliac bones as well over here. And so a young patient in their 20s with this infiltrative, expansile, heterogeneous appearing renal mass with really extensive disease on presentation, including retroperitoneal adenopathy and osseous disease. Certainly common things being common, we're going to think about clear cell RCC, renal cell carcinoma. But another disease you want to think about when you have certainly a young patient with quite extensive disease, despite the fact that this is not a particularly big mass, is medullary RCC. Now, medullary RCC is a subtype that is seen in patients with sickle cell trait. This patient happens to have sickle cell trait, and this indeed is a biopsy-proven case of medullary RCC.